Dr. Henry going to show me some scary things. See what he carry on his hand. Wow, bones! You see bones.
Okay, Angie, this is your spine, and this is about the correct size. You just measure up.
Yeah.
It's about your size, Angie.
Oh.
Okay. The spine is made up of 3 major parts. The lower back we call the lumbar spine. Has 5 vertebrae. Your middle back,
Yeah.
which is in here, has 12 vertebrae, and it's called your thoracic spine. The upper part of your back is actually your neck.
Yeah.
It's made up of 7 bones, and we call that your cervical vertebrae, or your cervical spine. Okay? There are 3 curves. Here's normally, okay? The 3 normal curves we'll show here. The neck curve curves inward. We call that our lordotic curve. The thoracic curve curves outward. We call that a kyphotic curve. And then we come back in with the lower back again, another lordosis. These things should all line up. And this will give you good posture. Now, deviation from this we would call abnormal posture. Okay? Now, on top of this spine, we have your muscles.
Oh, meat.
Yes. Actually, this is meat. This looks like meat.
Yes.
This is meat. Your muscles are actually meat.
Okay.
And this is what moves your skeleton. Okay? And you can see they're very closely related. Okay? Your muscles are attached to the bones. Okay? And that's what causes your bones to move.
Oh.
And any injury to the muscles or any injury to the skeleton will affect each other. So that's why we call it together muscle-skeletal system. Okay? Now, we are going to look at some abnormal positions and abnormal postures, just so you can see the difference.
Okay. So everybody has same bones. Even I'm prettier than you, I still have same type of bone.
Well, maybe your bones are a little prettier than mine, Angie. I'm pretty sure of that. But we all have similar bones.
Similar structure.
That's right. Similar bone structure.
Okay.
Okay? Now, abnormal postures,
Yes.
abnormal positioning of this bone will give you problems. And that's what we typically see in people who are working at a computer a lot.
Oh, I want to hear that.
Okay.
Tell me something
Because I know
about
that's something you do a lot, right?
Exactly.
You're at a computer a lot?
Yes.
Okay.
Yeah.
All right.
I really have some pain bothers me sometimes.
Okay. Tell me about the pain that you get when you're working at a computer.
Sometimes my back is really feel sore, and my neck, I think my neck is really feel uncomfortable. It's not all some big pain, but it's really some small thing really bothers me.
Okay. Angie, you just described typically people come in with who work at a computer. Those areas. Lower back, sitting too long.
Yeah.
Your upper back, because what happens with people who sit a lot at a computer, the shoulder starts coming forward, starts sliding. And that
Yes, that's
creates,
what's in me.
that creates the tightness in your shoulder. The longer you are working at a computer, you find the worse your posture tends to become. The people who have been working at the computer for 5 years are worse than those who are just started. Those who've been working at the computer for 20 years, you'll see that their posture typically becomes worse and worse.
Oh, so ugly, eh? Like this. Yeah.
Right. But there's something they can do about that.
Oh, really?
Okay? There's something that can be done. And I'll show you some of the things that we can do.
Oh,
Okay.
that means I have to quit my job? That
No,
will
no.
help?
No,
Oh,
no.
no? Okay.
The one thing we do not want you to do, Angie,
Uh-huh.
is we do not want you to quit your job.
Okay.
Okay? But we do not want you working in pain either.
That's true.
Okay? So, there are advice we can give people
Mhm.
who work at computers.
Yeah.
Okay? And we'll start with some of the things that we can do for you. Okay? Typically, for people who work at a computer a lot and have a slumpy type of posture, we find that there are areas of what we call dysfunction in their back. Areas where the joints are fixated, stuck together.
Okay.
Okay? Because if your back is in a forward position for a long time, same with this skeleton, if you put it in a forward position for a long time, you'll get used to that position.
I guess so. Yeah.
Okay? And it tends to cause what we call subluxations. As a chiropractor, we call them subluxations. But what that means is that the joints are stuck. They get stuck in that forward position. Okay? And they don't move back too easily.
That's true.
Okay? And you'll find that you have a stiffness in trying to straighten up. Because that's what happens when the joints start locking up. As chiropractors, we're trained to check your back and detect those. We can find those areas
Oh, you can
that are
find?
stuck. Yes.
Okay.
It's done by a procedure called motion palpation.
Okay.
That's what chiropractors are trained to do. You find the areas in your back which are moving or those that are not moving.
Okay.
Those tends to be the areas where there's not much movement. Those tend to be the areas.
Oh, okay. You want to show me where
Sure.
I have?
Well, let's do a demonstration here. Right? I'll
Okay.
get you to come around and sit down on the bench. Now, one of the ways, as I mentioned, called motion palpation, we place our hand on the spinal joints and we induce a little motion to your spine and we try to locate the areas that are not moving properly.
Hey,
Yes,
that's
down there.
the. Oh yes, that's the pin.
There's one area that we find is not moving properly for you. Okay? And it corresponds to an area of pain for you.
Oh.
Okay? There's no one there.
Oh yes, yes.
Okay. And check on your other side as well. As we're coming down the spine, we'll find areas that's right there.
Oh yeah, that's really. I really feel something there.
Those are joints that are not moving quite properly for you. Now you mentioned that you also have headaches and neck pain.
Yes.
Okay. I'm going to check in your neck. I'm just going to see which joints are moving or not. One here is moving. Feel this one there?
Oh yes,
It's a little tender.
yes.
Okay. And that's in the upper part of your neck. And this is the area that tends to cause headaches. Check in your opposite side. You have one here as well, don't you?
Yes.
You feel this one? Is it hurting?
Yes, yes.
Okay.
I thought I'm a very healthy person. Unfortunately not, eh?
Well, you are healthy.
Okay.
You are healthy, but you can be healthier.
I can be healthier?
And that's the role of a chiropractor. Okay?
Okay.
We try to make you healthier. We try to correct what is causing you problems. We try to get the root of the problem,
Okay.
and which is a different philosophy than what the medical treatment for your type of pains. Have you been to a medical doctor about your type of pains before?
Not really.
Okay. Typically, people may get an anti-inflammatory or a muscle relaxant for their headaches or back pain, but we know that it doesn't cure the problem.
That's true, I guess so.
A muscle relaxant, an anti-inflammatory, or painkillers such as Tylenol or Advil tend to suppress it. But the real problem is not gone away, such as for yourself. Spinal problems, if left uncorrected, stay there. You may have recurrent tightness, recurrent pain in the area, unless it's corrected.
Oh, what will happen in the future when I'm getting older?
Well, what you tend to find, the most visible thing that you see, you can stand up, Angie, yeah. The most visible sign that you can see as people get older is as their posture deteriorates, you see them tending to go forward, okay? Because everything in life that you do tends to be in front of you. On the computer, you're doing it in front of you. When you're watching TV, you tend to sit down, or people tend to drive.
Yeah,
Like
everything's
this.
in front of you, that's true.
Even cooking. You're cooking in front, and your head is down, your shoulder is down. So gravity, with time, will tend to take over. Will keep pulling you forward. So visually, it's not a good thing, having slumped posture. But from a health standpoint, it's not a good thing too. Because we typically find with poor posture, there's greater health problems, such as you mentioned before, and I've mentioned before, the neck pain, the shoulder pain, the headaches, they tend to come more as your posture becomes worse. So that's what happens to people as they get older, unless they do something about it.
What can we do?
Okay, there's a couple.
Don't tell me something too expensive, you know. So what can I do?
Okay, what we can do for you, and what chiropractors can do,
Yes.
is they can correct the spinal problems
Okay.
through manipulation, through adjustments with their hands. What you tend to hear is crack.
Boom. Crack.
People think it's something scary.
Yes.
It's not. It's actually a release of gas from the joint. It's not the bone themselves cracking, but it's between the joints. Let's get back to our spine here. You see that joint here. Normally, when there's not movement, it's very small force. Yeah. That's a joint. That's what we're doing. And it's usually very, very easy to do for a chiropractor. And no pain at all, or very little pain associated with an adjustment.
Okay.
Okay?
So you want to do a just adjustment on my back?
Okay, we'll show how an adjustment is.
Okay.
Angie, we'll see what we can do to get your joints moving.
Okay. I'm so excited for the joints moving.
Okay. Angie, I'm going to get you to sit down again.
Okay.
We're just going to lower your joints. Okay, and then you'll lie down. Okay? Lay back. Just lie down at the table, a couple inches here. Okay. And for this procedure, we're going to apply a little pressure through your arms and your shoulders. And I'm going to ask you to breathe in and to breathe out. And you'll feel a little quick like that. Okay?
Okay.
All right. Just relax with me. Take a deep breath in. And breathe out.
Oh, I heard that
Yeah,
crack.
you felt that movement?
Yes.
Okay, that was the movement of one of the joints. Okay?
Okay.
Now it's moving.
Oh.
We're also going to take a look at your neck. You mentioned that I've had this before. Let the audience. We've done an examination before. Full exam.
Yes. Okay.
So just.
Oh. Oh. Oh.
Yeah.
I thought you are going to take out my head. Give me a new one.
That is still there, right?
Oh, it's still there. I'm serious.
How's that feel? That's it.
No, it didn't hurt. But I heard that crack. Now I feel it to be fine. Before it's very tense. Now it's like. Okay, homework.
Okay. Posture.
Posture. Mm.
Posture is a very important component to your problem and to many other people's problem.
I know you wrote a few articles in some
Oh.
medicine journals
Okay. Well,
talking about that.
there's one condition that
Mhm.
I wrote about in the Journal of the Canadian Chiropractic Association. It's related to. It's a long word.
Oh.
Don't get too scared about it.
That scared
It's
me.
called the proximal cross syndrome. Okay, and typically people have this condition. It's about rounded shoulders, anterior head carriage, meaning their head is held forward, and they would have a muscle imbalance. The imbalance is a tightness in the shoulders,
Shoulders.
here,
Mhm.
tightness in the neck muscles,
Neck muscles. Okay.
tightness in the front, what we call the pec muscles,
Muscles.
and they have a weakness in the interscapular muscles, the muscles in between the shoulders.
Okay.
Okay? It's a muscle imbalance. This long word, proximal cross syndrome, is basically a muscle spine imbalance.
Oh.
Now here's someone's a little bit older than you.
Okay.
Okay, a lot older than you, Angie. Sorry about that.
Thank you.
But this is a more advanced stage of where you're at. You do have a mild case of this, what we call proximal cross syndrome.
Oh.
You have some rounding of the shoulder. You have anterior neck carriage. That means your head is held forward. And what we call also a little bit hyperextension of the neck. Right? And you can see that happening with people at a computer.
That's
As
true.
people sit at a computer,
In my office, everyone is like this.
exactly, they tend to adopt that. The longer you're in that position, the more that you will adopt that posture. That posture, that sitting posture, becomes your posture. You see, as a person sits, and you can sit now, and if you're not seated properly, you tend to sit forward
Yeah.
on the computer. And you can see that this is the proximal cross syndrome position. The rounded shoulder, the neck forward, a little bit hyperextension here, which causes jamming in your neck, causing tightness in your shoulders. This can be corrected, okay? Through exercise,
Yes.
through adjustments,
Yes.
but through cooperation with your viewers also, in changing the posture, to reduce posture strain. I'm going to go over with you how to sit properly first, okay?
Sit proper. I thought I always does that. No?
Okay, you might be thinking you're sitting properly, but I'll just review with you. To start with, we need a firm chair.
Firm chair.
A firm chair. This is a firm chair, very inexpensive chair. This is actually very cheap chair.
Okay.
Fine, that's good. It's firm.
Yes.
What we also need is a little cushion at the back.
Cushion. Okay.
Okay? Remember the 3 curves at the back?
Yes.
All right? The lower back curve is very important to maintain while we'll use back supports to do that. Okay? So this maintains your lordosis, the curve in your lower back. Okay? If your lower back is supported, you'll find that it's almost impossible to slouch forward.
That's true.
You feel that, Angie?
Yeah.
As we put pressure on your back,
Yeah.
the lower part, you'll find that your upper part straightens out. If your back is not supported, you'll find that over time
Yeah.
you tend to slouch.
That's true.
Slouching comes in. Okay? So we're going to put this little back support back in for you.
Okay.
Okay, and then we'll go to the side. Now, the other part of the equation, you can have a very good chair, you can have a very good back support, but if you don't sit in that chair, it's no good. You end up sliding forward. It's no good, which I find a lot of people do.
That's
Okay?
true.
Now, how do we get you to sit back in that chair? One of the faults we find, yes, that's the posture.
Yes.
Sit forward in your chair. One of the faults that we find is the chair height not adjusted properly. Most chairs tend to be to remedy that, we introduce footrest. Okay? Very simple. What we want is for your knee to be at the same height or slightly higher than your knee.
Oh,
Which right now it is. It's just slightly higher. Okay? And you feel that you can sit back a little bit more because you don't have the pull of your legs. Now, just let me remove this for a second until your body
Oh,
just
yes.
comes forward. So for most people, a footrest of about 3 inches tends to be what most people need to help keep them firmly back in the chair.
Okay.
Okay? The other thing to adjust for is the height of the monitor. The monitor should be slightly higher top of your head, top part of the monitor. Okay? You should be looking downward about 10 degrees from the center of the screen. Okay?
Should not move like that.
Should have it too high.
Okay.
Have that adjusted. The other thing is the arm angle. Height of the arm is here. If it's too low, down here, weight in your arm. We need an arm angle, roughly about 15 to 30 degrees maximum
Okay.
away from your body. Okay? And that would be a good arm angle for your computer.
Okay.
Okay? The other thing that we need is for your monitor to be right in front of you, Angie.
Oh, right
Okay.
in front of me.
Right in front.
Okay.
A lot of people have their computers off to the side. This
That's
isn't proper. It'll cause a lot of neck problems.
Oh,
Okay?
so always will cause my neck.
Yes.
away.
Yes. If you add up the time,
Mhm.
you'll spend hours with your head turned to one side. It will cause you neck problems
Okay.
and neck pain. Okay? So make sure that monitor
In front of me.
right in front of you.
Okay.
And then you'll have less problems with the sitting. Okay? It's also important to get up, and we typically recommend every hour to get up, do some stretches, and walk around a little bit. You'll find that that will relieve some of your tension and stress as well.
Oh,
Okay? So
So-
every hour.
every hour. Oh,
Okay. Now that we talked about getting up and walking around,
Yes.
we're going to look at your standing posture.
standing posture.
Okay,
Okay.
and I'm going to give some recommendations on what is a good standing posture.
Okay.
Okay? Now, similar in standing, people tend to carry themselves in a forward position. Okay?
That's true.
With their arms a little bit forward, their head a little bit forward to their body. Okay? This is not a good posture. I'm going to show you how we should correct that. Okay,
Okay.
Angie? All right. One of the things that to keep in mind when you're having a good posture is the order of your hips, your chest, and your face.
Mhm.
Okay. Typically, people with bad posture tend to walk like this. They have their face first, then their chest,
Then body.
then their hips.
Mhm.
Okay. We have to reverse that. For good posture, you want your hips in front, then your chest, then your face. So your face should be behind your chest,
Oh.
not in front of it.
Okay.
Okay, so that's one of the ways you can measure how you're standing. Okay.
Mhm.
Now, I want you to contract your glute muscles. That means
Okay.
your butt muscles. I want you to contract them
Mhm.
and push your hips forward a little bit. There you go. So a little bit forward of the hips. Okay.
Okay.
And you think about, and what I like to tell people is to think about this bone right here. Just think
Yes.
up just a little bit. Just think up.
Think up.
Yeah, let me think that. Okay, I'm going to push the hips forward a little bit there. But we don't want to sway back. So let's do a little correction here. There. Good. Then you want your head right there. Okay.
Wow.
Do you feel a little bit different?
Very different.
Okay.
Okay. I still should move.
Yes, at the beginning you'll feel different. I want you to almost feel like you're leaning backwards. The feeling that you should feel is like leaning slightly backwards. Because relatively you are leaning backwards. Because you're leaning forward, or most people tend to lean forward. Okay?
Okay.
So the feeling I want you to notice, okay?
Okay.
I feel like I'm leaning slightly backwards. Okay? With time, you won't feel like leaning backwards. You just think, okay, this is my posture.
So my head is still should be
Yes.
Okay.
Oh, yes.
Okay.
Let me get you to the mirror here, Angie, and let me
Yeah.
show you how the position of your head should be. Okay? When people have poor posture, they tend to carry their head a little bit low. Their head tends to be a little bit low. Okay? Now, I'm just going to give you a marker on how you can check yourself how to carry your head at the proper height.
Okay.
Now we're going to look at your ears here.
Yes.
Okay. Center of your ears and the tip of your nose. You draw a line across the ear to line up. That's what it does now. You see that?
Yes.
The head is low, you see? It's
Lower.
lower than
Yeah.
lower than your ear. Okay. Right there. Now, you just hold that position. When you get proper if this position, your neck is soft, the muscle is soft. When it's soft, it means it's relaxed. Just put your head forward for me, Angie. Feel that?
Yes, that's
Tension.
true.
There's tension in your neck right now. If we lift it back up, you'll find that it's softened. When the muscle is softened, it means it's relaxed.
Okay.
Okay? Now, the third area that we
Yes.
like to talk about with posture, okay? Posture is not just standing, it's not just sitting, it's also sleeping.
Wow. Sleeping also has
Okay,
something to do.
Exactly.
Okay.
You spend 1/3 of your life sleeping,
That's true.
okay? It's a very important position, okay?
Sleeping.
The sleeping posture, okay? How do you tend to sleep, Angie? You sleep on your back, your side, or on your stomach? Which?
Back.
On your back.
Yes.
Okay. All right. That's a good start. Okay,
That's
back is a good position to be in. The two
Okay.
recommended postures for sleeping is on your back and on your side.
Okay.
Okay? Never, and I repeat to your audience, never sleep on your stomach.
Oh, the face down.
The face down position. Now the face down position, people tend to turn their heads to one side. When you turn your head to one side, you're jamming your neck all night.
Mm.
With time, this will cause your neck problems.
Okay.
And people who are stomach sleepers tend to have the complaints, neck problems, headaches, even lower back pain because their back is arched all night. Okay? So I'll just go through with you how to sleep on your back and your side.
Okay.
And we're going to use some pillows.
Okay.
All right? How many pillows do you use? One?
One.
Okay. I like to recommend people sleep with 2 pillows.
2 pillows. I only have one
Okay.
head.
One for your neck and one for your legs.
Oh.
Okay? I'll be right back. I'm just going to grab the pillows.
Okay.
Hi, Angie. Are you comfortable?
Very comfortable.
Okay. Right now you're sleeping with an orthopedic pillow. It's curved. Okay? Remember the 3 curves of your neck? This is supported of 3 curves of your back. One of them is your neck curve, okay? And this has a curve that fits the curve of your neck.
Oh.
Okay? So for your audience, I'd like to recommend that they use these orthopedic pillows, which you can find typically in most drugstores.
Okay.
Will have these type of pillows with the curvature in them. Okay? That will support your neck. Now, the other thing that we like to recommend is that you sleep with a pillow underneath your knees.
Oh.
Have a slight angle in the knees will bring your back flat against your bed. Without that pillow, you'll feel your back arch a little bit. You feel that? Just
Yes,
a slight
that's
movement.
true.
As you raise the knees, you'll find your back flatten out.
Flat now.
Okay.
Yes.
So that's why we tend to recommend, we like to recommend, you sleep with a pillow underneath your knees when you're lying on your back. Okay? Now the other recommended position is the side position. Okay? When you lie on your side, we like to recommend that you use the pillow between your knees.
Okay.
Let's just show how we're going to do that. Okay, so if you're on your side. Okay. Now, you feel comfortable?
Very comfortable.
Okay. I'm just going to show why we recommend this. Your back is in a better alignment when your knees are raised slightly.
Okay.
Because without the pillow between the knees, what tends to happen is your knee will drop forward. You'll find your spine rotating. It's twisting slightly as you're sleeping without it. So when you have the pillow here, you find that your hips are level, your back is not twisting. Okay? And your head is also in a good neutral position on the side. Okay?
This is really comfortable.
Good. Okay, don't go to sleep yet.
Oh,
We're not finished. Okay. Okay, Angie, we get you.
This is really new. I never know I needed 2 pillows for
Yeah.
sleeping.
I want to talk about some exercises
Okay.
that you can do, okay? Some very simple exercises for people who have similar problems, that tension in the shoulders, also neck pain, we can also talk about how we can correct your posture with some exercise.
Okay.
Right? Now, one exercise that we like to recommend is just a very easy shoulder rotation exercise. You find that this is what we call mobilizing your shoulder, just inducing some motion into the shoulder girdle. But as you pull back, this is also a good exercise to strengthen your muscles between your shoulder blades. Those are the muscles that we had mentioned earlier that are weak. Okay, so pulling back, we're using that muscle in the back.
This is very easy.
It's very easy to do. Okay. Now, there's one exercise that I like to recommend. It's called, what I call is the posture exercise. Okay. It's the all-in-one posture exercise. We're going to stretch things that need to be stretched.
Okay.
And we're going to strengthen muscles that need to be strengthened.
Excellent.
Okay. Now, this one, I want you to hold your hands up to the side. Good. I'm going to ask you to push your hips forward. Okay, that's it. Tuck it in. And good. Pull your arms back. I want you to look up at the same time and pull your neck. I'm just going to explain to the audience why this is a good posture exercise. Because your shoulders, which were once rounded, are now pulling back. Okay? We're pulling your shoulders backwards, we're flattening out your upper back, which was too rounded before. So we want to flatten that out. We want to stretch your muscles in the front, the pec muscles, which are too tight. We want to stretch them. We're also strengthening the interscapular muscles, which means the muscles behind your back. We're causing them to be strengthened. We're using that muscle. Okay? The other thing that we're also doing with this is we're pulling your neck in. Because the neck muscles, which were weak, which cause it to go forward, we want to pull back. So we're using that muscle to pull back, strengthening the weak muscles, which are in the front of the neck, but also looking up, relaxing the muscles, which are too tight behind you.
This is even more easy.
Yes. Now, when you hold that posture, hold that position, I like to recommend that you hold it for 10 seconds. Hold that position for 10 seconds.
Yes.
Then slowly release your arms. Just slowly release, but not all, and stop. Okay? What you'll find is that as you repeat the exercise, your posture will tend to get better. When you drop, don't drop it all the way down. Drop it down slowly and maintain some of that position that we're trying to do. Okay? So this exercise is very good for correcting this type of problem brought on by too much sitting, brought on by too much computer.
I even can do in the office during the break.
Exactly. That's what we want you to do. We want you to do it in the office. Okay? And do it every break.
Excellent.
Do it in the morning, do it after work, and repeat it 10 times each time you do it. Okay? You'll find that your posture will improve as you do this exercise. It's also good to do it when you get up from a chair or get out of your car. Because what's happened is even down low, you need stretching. Because as you're sitting, we've been talking about the upper back a lot, but when you've been sitting for a long time, you'll find that down here tends to become tight. Your lower back will become tight as well from this bent forward posture. Okay? Like I mentioned before, everything in life will tend to take you forward.
That's true.
Okay? As we mentioned before, whether you're cooking, cleaning at the computer, you're going forward. We have to deliberately introduce something that takes you backwards. Does that make sense?
Very makes sense.
Okay. That's how we regain our balance, Angie. Okay?
Excellent.
All right? By going backwards, we're pulling things backwards. We're pulling the muscles at the front, which are all too tight. We're stretching. We're strengthening the muscles in the back.
Dr. Lee. I believe all this advice is really easy to do and everybody can follow it. Thank you, everybody. Thank you for watching TorontoTV.